Hello, this is Dr. Grande. Today's question is, what are my criticisms of person-centered therapy? So this question was submitted by a subscriber, and I'll certainly answer it. I'm going to start with just a summary of person-centered therapy before getting into criticisms. So person-centered therapy is also known as Rogerian Therapy. It was created by Carl Rogers, and there were several names for it, but I'm just going to refer to it as person-centered therapy because that was the final name in the theory. Now, person-centered therapy is a positive therapy, and it's designed to help a client achieve what Rogers referred to as self-actualization. It was highly dependent on the therapeutic alliance, and it holds the client as the expert. Rogers believed that a client was moving towards success, moving towards self-actualization, and would get there, but sometimes obstacles would get in the way, and this is where person-centered therapy could be helpful. He has 3 core conditions in his theory: accurate empathy, unconditional positive regard, and authenticity. Now, what's interesting about person-centered therapy is it's non-directive. So, unlike a lot of other therapies, there's never really any advice given. There's an idea in person-centered therapy that if the therapist can just stay out of the way and be empathetic and non-judgmental and be genuine or authentic, that progress will be made. So for some of the criticisms of Rogerian therapy, well, the first criticism would be the idea of non-directive therapy. Really, this would be more accurate if it was categorized as less directive therapy. All therapy, in some sense, is directive. We can consider the idea of bias when we consider the idea of whether therapy is non-directive or directive. All human beings have some amount of bias. It sits on a continuum. And of course, mental health clinicians work to minimize the impact of their bias, but it's always going to be there, even if it's subtle. So in a non-directive therapy like person-centered therapy, the bias of the therapist is still intruding on the counseling session. We accept that as part of counseling. It's what happens as part of the human condition, and it can't be avoided. Certainly, as I mentioned, therapists work to avoid bias, especially harmful bias, but some bias is still going to be there. So really, to say that a therapy is non-directive and to mean that it's purely non-directive means that there's no therapist in the room. True non-directive therapy would be a client sitting in an office by themselves. So the idea that non-directive therapy even exists is one of my criticisms of person-centered therapy. Another criticism of person-centered therapy is the reflection piece. There's a lot of reflections, a lot of encouragers used in the session, and this can seem like an echo. So if somebody wants direct advice, practical advice, they could be frustrated by the therapist rephrasing what they say. So I think this is helpful to an extent. I think reflecting, of course, is important, but person-centered therapy, pure person-centered therapy, takes it too far. Other criticisms I've heard about person-centered therapy include that these core conditions, even though they were first packaged this way by Carl Rogers, had already existed. Therapeutic modalities such as Adlerian therapy already used a similar approach to form a therapeutic alliance. To be fair with this criticism, Carl Rogers, as I mentioned, is the first person who put it all together in this way, and he really wrote a lot about the therapeutic alliance and how these core conditions relate to it. Another common criticism I hear is that person-centered therapy lacks structure and that it takes too long, meaning we can see a possible solution, a way to be helpful to the client, but we deliberately don't mention it because we want to remain out of the client's way. We want to keep reflecting and not involve our own bias and our own ideas. I think this is a fair criticism of person-centered therapy. It makes sense in an environment where there's little direction that therapy could take too long. The last common criticism I've heard of person-centered therapy is that Rogers claimed that person-centered therapy worked for every disorder. And of course, we know that it does seem to be effective for some disorders and not as much for others. Now, with all these criticisms of person-centered therapy in mind, it's important to realize, of course, that these don't negate the value of person-centered therapy and the really incredible contribution that Rogers made to mental health therapy in general. Person-centered therapy, I don't believe, works well as a standalone modality, but it's fairly critical that it's integrated into other modalities. It is the way of being for a number of therapeutic modalities. And without person-centered therapy, without the contributions of Rogers, it's hard to imagine how some of these other modalities would really have a way of being. What would they use? They would have to come back to something based on the work of Rogers, or something similar to that. So overall, person-centered therapy is important, but is limited. And I feel that it's better used when it's integrated with other modalities. I hope you found this description of the criticisms of Rogerian therapy to be interesting. Thanks for watching.